If your doctor has told you your blood pressure is a little high, your blood sugar is borderline, your cholesterol needs to be watched, you might have metabolic syndrome. And it's far more dangerous than most people realize. Today, we are going to explain what metabolic syndrome is, why it's so dangerous, and most importantly, how to reverse it before it's too late. My name is Chris, nurse practitioner here at Elite Medical.
My name is Eldon, nurse practitioner at Elite Medical.
My name is Don. I'm a doctor here at Elite Medical.
Metabolic syndrome is not a disease. It's a cluster of medical problems that occur together and dramatically increase your risk for heart disease, stroke, type 2 diabetes. Nearly 1 in 3 adults has metabolic syndrome, and most don't even know it.
So here's the thing. You're diagnosed with metabolic syndrome if you have 3 out of 5 criteria. These include 1, a large waist circumference over 40 inches for men and over 35 inches for women. Elevated triglycerides at 150 or higher. Low good cholesterol, which is your HDL. Elevated blood pressure at 130 over 85 or higher. And elevated fasting blood sugar at 100 or more.
Each of these factors alone is concerning, but together they create a synergistic risk that dramatically increases your chances of developing diabetes, heart disease, heart attack, and stroke. Metabolic syndrome is your body's warning system. Ignore it at your peril.
One of the biggest mistakes in healthcare is dismissing those borderline labs. Prediabetes means damage is already happening. Borderline blood pressure still damages blood vessels, heart, and kidneys. Slightly elevated triglycerides indicate metabolic dysfunction. These numbers don't exist in isolation. They're part of a larger syndrome, metabolic syndrome.
Metabolic disease progresses in stages. Stage 1 is insulin resistance, which is often silent. Your cells stop responding to insulin, so your pancreas produces more and more insulin to compensate, keeping blood sugar normal for years while damage is occurring.
Stage 2 is prediabetes and metabolic syndrome. Fasting glucose rises to 125, A1C climbs, blood pressure increases, triglycerides rise, HDL drops, and belly fat accumulates. This is the critical window where the disease is still completely reversible.
Stage 3 is type 2 diabetes and cardiovascular disease. Blood sugar rises above 126. A1C exceeds 6.5. Plaque builds in the arteries, and the risk of heart attack, stroke, kidney disease, and nerve damage skyrockets. At this stage, we may manage disease, but we rarely reverse it.
So you may ask, what causes metabolic syndrome? Diet is the biggest factor. Excess refined carbohydrates, sugar, fructose, seed oils, and processed foods create constant insulin spikes that drive insulin resistance.
And a sedentary lifestyle makes things much worse. Lack of movement causes muscle to become insulin resistant. Muscle is your primary glucose disposal system. Less muscle means worse blood sugar control and a slower metabolism.
All this can lead to excess visceral fat, which is essentially fat around the organs in your body. This fat is metabolically active. It releases inflammatory chemicals that worsen insulin resistance and create a vicious cycle of fat gain and metabolic dysfunction.
Added to that, chronic stress raises cortisol, which promotes belly fat storage. That's the visceral fat around your organs. It worsens insulin resistance and disrupts sleep. Poor sleep further worsens blood sugar control, appetite hormones, and cortisol levels.
Hormonal decline also plays a major role. Low testosterone in both men and women, thyroid dysfunction, and estrogen or progesterone imbalance all worsen insulin resistance and body composition.
So all this nasty stuff we talked about, all this bad news, forget about that. The good news is metabolic syndrome is reversible, but it requires comprehensive early intervention, not waiting until you have diabetes or heart disease.
So the first step would be comprehensive testing. We don't just look at basic labs. We check fasting glucose and fasting insulin to assess insulin resistance, A1C for long-term blood sugar, advanced lipid panels, inflammatory markers, hormone levels, and liver function.
Next comes nutritional intervention. This isn't about eating less, it's about eating smarter. Reducing refined carbs and sugar, increasing protein, choosing healthy fats, eating whole foods, the most important thing of all of this, and using strategic meal timing can dramatically improve insulin sensitivity.
Exercise is critical, especially strength training. Muscle is insulin sensitive tissue. The more muscle you have, the better your body handles glucose. Even simple habits like walking after meals can significantly lower blood sugar spikes.
Weight loss plays a powerful role. Losing just 5 to 10% of body weight can dramatically improve metabolic markers. The goal is fat loss while preserving muscle, and medical weight loss can accelerate progress when appropriate.
Hormone optimization is often the missing piece. Optimizing testosterone, thyroid, and other hormones improve metabolism, insulin sensitivity, and body composition.
Sleep and stress management also play an important role and are non-negotiable. 7 to 9 hours of quality sleep and effective stress reduction are essential for reversing metabolic disease.
In some cases, medical therapy is appropriate. Medications like metformin improve insulin sensitivity, and GLP-1 medications such as semaglutide or tirzepatide can dramatically improve insulin resistance and promote weight loss.
With the right approach, improvement happens quickly. Within 4 to 8 weeks, blood sugar, blood pressure, and triglycerides often improve. By 3 months, many markers normalize. By 6 months, many patients completely reverse metabolic syndrome.
Our goal is we don't want to wait until you have diabetes or heart disease. We intervene early using comprehensive testing, create a personalized plan, and focus on reversal, not just management.
And nutrition is key. Whether you follow a keto diet, Mediterranean diet, plant-based diet, we can sit down with you and offer a personalized plan in keeping with your likes and dislikes and something that will work for you.
Also, physical activity. We will also sit down with you and create a personalized plan. Whether you work out in a gym, work out at home, whether you have workout equipment or you don't, we will sit down and assist you in creating a plan to increase your physical activity to decrease your chance of metabolic syndrome.
And then come on in, we can help monitor your progress with our in-body scanner. That'll measure skeletal muscle mass, water weight, body fat percentage, all these things that we can help trend to see how you're progressing and decreasing your risk for metabolic syndrome.
We focus on reversal, not just management.
Additionally, we will do A1C testing, which is a 3-month glucose, and a comprehensive lipid panel, no extra cost to you, so that we can see how your metabolic syndrome is reversing.
So remember, if you've been told that your labs are borderline, or if you have 3 or more risk factors, you likely have metabolic syndrome. The good news is it's completely reversible, but only if you act now.
If you're a man feeling tired, weak, and just off, low testosterone could be your problem. And it's more common than you think. Watch our next video for more information. Feel elite?
Be elite.
Elite Medical Ocala.